Hi, my name is Crystal Sweeney. I'm going to be giving a report on Miss Marilyn Hughes. I am the nurse for the surgical unit, and she's going back to the OR for emergency fasciectomy. Her date of birth is 9/22/77. So just a little bit of a background. Um, so she recently had an ORIF due to a tib rib fracture. She came back to us saying that originally she was medicated for a pain of 7 out of 10. She was medicated with oxycodone 10 milligrams. After being ineffective, patients stated that her pain was very severe, 10 out of 10, or excuse me, 8 out of 10 pain. Um, so she was giving IV morphine. After that, the patient said that this was 4 milligrams of IV morphine. Patients say the pain was actually worse. So we're suspecting that she has compartment syndrome, and so that is compartment syndrome. It's an abnormal increased amount of pressure on the anatomical compartment. It needs a neurovascular assessment QRly, and it can lead to permanent and nerve damage or necrosis. So, originally, let me get my notes here, excuse me. Um, she was admitted for surgery. She came back with a possible compartment syndrome. She had poor perfusion of the left foot. Um, She previously didn't have any medical complaints before this tib fracture. She came back to us and it was elevated on an orthopedic pillow. On assessment, we realized her orientation status was times 4. Her SATs were 98%. We noticed her left foot was cold and cyanotic, and the ACE dressing that was on her leg was very tight. So to promote comfort, we loosened the ACE dressing, which the patient stated that was comfortable. Um, we also lowered her leg from the orthopedic pillow to promote vascularity and ease of comfort. That of which, with the repositioning for comfort, we can delegate that to the unlicensed personnel. Um, After all of her symptoms and vital signs were taken, um, we were able to call the provider about her conditions. Um, he was to come to see the patient. Um, Recommended that we take her vital signs every hour, contact the provider if there's any changes, and frequently assess for her pain. So some of the things you asked what a hold on, let me find it. You asked what a fasciotomy is. It's performed to relieve the pressure by through a small incision in the fascia. Some of the things that us nurses need to do for compartment syndrome is elevate the limb above the heart for I prevent it, but she already has a compartment syndrome. Remove any constrictive dressings, including casts. We've done that, and that actually helped her condition. And if it's not relieved in an hour, which it wasn't, this is why the physician is recommending us to go to the emergency fasciotomy. It's a pretty serious condition, because it can cause permanent nerve damage. Let's see what else. And did you have any questions? Her IV, okay, her IV site, it's in the right AC. So it is saline locked. Um, and I'll be coming up with my unlicensed personnel for assistance with transports. Other things to consider: the patient's she's gown. We have given her an additional chlorhexidine bath per our protocol. We've set her up in bed and gave her some water per the doctor's recommendations prior, and she tolerated that well. So if you have any questions, feel free to give me a call. Thank you.